What do you think? We'll be back with more of The Link and Dr. Hoa Nguyen of the Physicians Advisory Group. Next, we're going to talk about the unvaccinated. Yes, and Dr. Hoa, the unclean. Oh, God.
Hey,
those who cannot win $10,000.
That's pretty
or a
nice.
brand new car.
Or a brand new car. Yeah, so he sent
people.
Yeah, he sent me this article where it talks just about the hospitalizations, and the one thing a lot of them have in common is, guess what? They're not vaccinated. So we'll talk about that. Coming up, 7:27. We're back with more of The Link next. Good morning.
Our World War II survivors have endured more sacrifice, suffering, fear, hope, and perseverance than we can ever imagine. Their stories have been passed down from generation to generation and have become a central part of the legacies and histories of our families. As we commemorate our 77th annual liberation, we invite you to share these stories and special memories as we present My Liberation Hero. During the month of July, KUAM will feature these tributes on KUAM News as well as on our digital platforms. We ask that you start your video or written submissions with the phrase, My Liberation Hero is. And please submit pictures of your heroes if you have them. Send your emails to liberation@kuam.com. And let's give everyone a chance to reflect and remember these special times and people in our history. Happy 77th Liberation Day, Guam.
Brought to you by Coast 360 Federal Credit Union, Ordot Dental Clinic, and Vince Jewelers.
Family platter of fried chicken?
Check.
Tray of red rice?
Check.
Birthday cake?
Check.
1 case of water?
Check.
12-pack of beer?
Check.
2 cases of Pepsi?
Check.
When you have a long checklist but are short on time, we got you. Get it delivered by us. Order on the app or website at uno-go.com. Guam on demand.
Shoot, I forgot the paper product.
Oh wait, UnoGo has that too.
KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time each Friday to talk food, taste food, and bring you all the latest and greatest in food from King's Restaurants and Ruby Tuesday Guam, old faves, new hits, and everything on the menu in between. It's Feed Me Fridays on The Link.
Catch SportsLink on the KUAM News Morning Show, The Link, every Friday to hear about the latest in sports news, game schedules, athlete profiles, and more. SportsLink,
brought to you each week by Cure Alkaline Water and Mariana's Irrigation and Landscape,
airs every Friday across the multimedia platforms of KUAM. Tune into the broadcast on Breeze 93.9 FM, on KUAM TV 11, live streaming through the KUAM News Facebook page, or view highlights on YouTube, KUAM News Facebook, and Instagram. SportsLink is hosted by Dave Delgado through KUAM Sports, and he will make sure that everyone knows what is happening on the fields, in the gyms, and everywhere in between.
As a reporter, I often ask people what compelled them to get the COVID-19 vaccine. For me, someone who's lived through coronavirus, I can't help but fear the idea of possibly infecting others, unknowingly passing it along to someone with a lesser immune system, someone's mother, father, grandparent, or someone who wouldn't be as blessed to suffer only minor symptoms. When I contracted COVID, that is what weighed most on my heart and mind, and that's why I did everything in my power to prevent this from happening, by following public health protocols. And now I am doing the same thing, being mindful my decisions, choices, and actions don't only affect me, but the entire nation. So I chose to get vaccinated, simply to protect others. My name is Adriana Cotero. I'm a KUAM News reporter and anchor, and a proud member of the vaccination.
Join the vaccination. Scan and plan. For more information, go to KUAM.com.
Brought to you by American Medical Center, your partner in healthcare.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage, with generations of Filipinos calling Guam home. KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by the Bank of Guam and KFC. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
KUAM Communications continues our perpetuation of our Chamorro culture, language, and heritage with features available to our listening and viewing audience, including streaming of Chamorro music 24 hours per day on Isla Digital Radio on KUAM.com and the KUAM News app. Chamorro News Update, weekdays on The Link and the KUAM News YouTube channel. Conversations about life in our Chamorro language podcast, Cuentos Tapoco with Kin Conception. Seasonal specials, shows, and other features highlighting the beauty of our language, culture, and history. It's a new era of our continued commitment to our Chamorro heritage. Isla, watch, listen, stream. Viva Isla!
Help us celebrate the class of 2021. KUAM wants to help you celebrate this touchstone moment in the lives of your graduates. For the months of May and June, we will flood the social media pages of KUAM with photos and well wishes for the class of 2021 grads. Log on to KUAM.com to submit photos and brief messages or captions. Then look for your special grad on KUAM Instagram and the Facebook pages from all of your friends here at KUAM. Congratulations, seniors!
Listen, watch, and learn from the daily Chamorro news updates from KUAM News. Catch them on The Link during the 8 o'clock hour, streaming online on Isla Radio, or on the KUAM News YouTube channel for your convenience. Tune in and stay informed, all while preserving our precious culture through the daily use of our native Chamorro language. Chamorro news updates are brought to you by your familia at First Hawaiian Bank.
June makes the best malasadas in Hawaii, a fact not lost on Daryl, whose brother Byron is cooking the onaga he caught at his secret fishing spot with his girlfriend Malia, who used to work for the Shave Ice Guy, whose second cousin Vince drives the school bus ridden by Calais, whose auntie makes the best malasadas in Hawaii. Everything here is connected, and with the new First Hawaiian Bank mobile app, you can stay just as connected to your finances, and it all starts with yes.
And Sabrina, call 637-0094. Breeze 93.9 FM.
Antulaika hinasomu saohi tiparon dinguzu neni no yumagi nigui naizamu zondala tuparaitoni unayola osmu aizansala pemu loki este sinyapai utugwido neni no yumagi nigui naizamu zondala tuparaitoni. So if you ever change your mind,
Chris and Christy in the lawn in the house. 7:34. Hey, good morning, Thursday, June 17th. This is The Link. My name's Chris. Jason's over there, being tall. Sabrina Salas-Mantanani joined us in the KUAM News Zoom room from Las Vegas, Nevada. What's the temp there today, Bree?
Hot.
Oh, it's hot degrees.
It's probably over 100. Yeah.
Oh, you know what? I don't know. It was like 108 yesterday, but it was actually hotter in Guam. It may have been cooler on the thermometer, but it was hot yesterday, guys.
Oh yeah, I went walking yesterday, and I'm pretty much charbroiled now.
I mean, it was like that painful hot, right, sir?
It's 114 degrees.
Yeah, I don't know what's going to be more brown here, the native people or the grass.
Good one, Jay. Dr. Hoa Nguyen, the chairman of the Physicians Advisory Group, joins us. Doc, can we kind of start with a question, because we were talking about this well, the vaccination effort, and I had gotten a message from, and I'm just going to go ahead and read it to you, and we're going to go ahead and blank out the names. Dear Chris, I was vaccinated in January, first dose of Moderna, had a bad reaction 9 days later. I went to see my primary care physician, and he recommended not getting second dose due to my reaction. He advised me to wait for the J&J in May, but at the time when I inquired if anyone had ever switched from Moderna to Johnson & Johnson, it wasn't done yet, so I declined getting it. I called my primary care physician about a week ago to see if he had given it some thought about me getting the vaccine, and he said it was not recommended. What advice could Dr. Hoa give to those who may be experiencing the same situation?
Yeah, that's a very valid question, and it can be answered by two ways, right? I mean, if you have a reaction that to the point where you need to have an intramuscular injection of some sort to reverse your reaction, or you need to be somewhere admitted to a hospital, yeah, I wouldn't get the second dose at all. Again, can you get the second dose? Yeah, you can get the second dose. Really depend on what she had. And she had to talk to different physician and get the second opinion. She got the first dose, so she's about 70-80% protect already. But can she skip the second dose and not get to 90%? That's a choice that she feel comfortable or not, right? So I think the absolutely contraindication of have any type of second dose because reaction is if you have to need some type of medication to reverse it, or you had to be in the hospital. But majority of the time, yeah, you have some fever, chill, rash, body ache that can be pretty severe, but it's not a contraindication to get the second dose. That's number one. Number two, can you mix the dose, between Moderna and Pfizer? Yes, and you can, not something that you want to do. You should stick with the same vaccine if possible, but in case if you don't have someone that makes a mistake, it's okay to get the second dose with the different vaccine, with Moderna and Pfizer. Now, there's some studies show that that in case you have to mix the second dose, actually your response to the vaccine is somewhat better. I know it's the same mRNA, but it works differently in some way, and then actually your immune system response is better, but that's not something that we recommended. Now, to jump from Moderna, Pfizer to J&J, yeah, it's not a recommendation that you do that. It's not a totally different type of vaccine. So it's not recommended you jump from mRNA to a different type of vaccine like J&J. Again, J&J, the other one that you have to watch for is in female of the age of 18 to 50, you really recommended to get another vaccine because there's a slightly risk of having the thrombosis, so the blood clots, that's what they call it. So for female from 18 to 50, we recommend you not get the J&J and go with another vaccine. That's the only thing that you have. On her case, I would say that it really depend on what reaction she really have. Most of us don't want to give an opinion to say that, hey, it's easy to say no, you can skip the second dose, but I don't know the situation. But again, the only thing that contraindication, if you get to have some injection to reverse it, or you have to be in the hospital.
Doc, we had another comment here. I think I know the answer to this one already. Any studies currently being conducted on the aftermath of vaccines?
The vaccine have very low side effect, and it's a new vaccine. So like anything else new out there, they're going to continue to monitor any type of persistent side effect or reaction from the vaccine as we go every day. There's website that you can go and report this. So so far, there's millions and millions and millions of those given, and they consider a very safe vaccine at this point. No, there's nothing that long-term reaction to any vaccine. I mean, there's always case, but very, very few cases, even with the normal vaccine like tetanus or MMR, they all have, very few incidents report, but the benefit really outweighs the risk.
I also wanted to kind of ask, maybe it's a little early for this, but we did ask before, what's going to happen next year when we have to get the booster? Is there anything more clear on the booster shot for COVID vaccine?
There's report that we more likely will need the booster, an annual booster. There's nothing definitely coming out yet. Our first rollout vaccination in December. So you are about 6 months out. So I'm very sure that the next few weeks, the next few months, you're going to hear something about the booster. And yes, we have to plan to some strategy to approach the booster, because what we do right now is it's not going to work for the next year or so if we're going to need the booster, especially if the booster are given for free again by the government. So that's something to worry about. And vaccination, immunization, we thought it's going to be anywhere from 6 months to a year. Hopefully it's a year. But if we don't plan carefully, and your immunity kind of wean off at the end of 6 months to a year, can we have another surge? Yes, we can. So we really have to be careful on thinking way ahead. Because if your immune system is down, the chance that we have a surge, because the immunity is down for the whole island is a true thing. So we have to start thinking ahead of time and not wait until some of us immune system are down. Just like mine, I had mine in December. So yeah, sometime in October, I'm going to start to worry that, hey, am I going to have the immunity that I want to be to protect myself, my family, and my patient? So I really have to look forward to get a booster somehow.
Can we go over the new protocols that are going into effect? When is it? Later this week, or is it next month?
Yeah, Chris, the new protocol is pretty simple. Whenever the governor approved it to roll out, that the fully vaccinated people is okay. They're the same. They go home, no PCR testing needed. They just go home with no quarantine. For the partially vaccinated or the unvaccinated, the patient coming in, we're going to require them to have a 72 hours PCR testing before they arrive, okay, to do home quarantine, okay, for 10 days. Now, they can be tested out on day number 6, just like when you're in the hotel quarantine. If they test out negative, then they'll be okay. So that's new things that will come out. And if you come in without the PCR testing as required, you will be in the hotel quarantine, either by the government or by your choice, but you will be paying for it. The government not paying for this because you know the requirement and your choice not to get it before you come in. So you will be hotel quarantine and expense. So that's the main difference. And, we make exception for some WHO vaccine that's approved, like the AstraZeneca, the AZ, the Sinopharm. Those are the ones that they approved by the WHO. So foreign countries have been and they have those vaccines. The people that are fully vaccinated. So that's a new protocol. Whenever it's come out.
Okay, yeah, June 18th. You said AstraZeneca?
Yeah.
Or WHO?
I think Sinopharm and Sinovac is the two that WHO approved, and they have the same efficacy as J&J, and then the high 70, 80% the efficacy. So there's enough study now to validate that. So those will be approved if you can validate that the vaccine.
Okay. All right.
And if we do well on that, then hopefully by July, when we have 80% of the island vaccinated or more, and then the next guideline would be much better than this one. The next one more likely we look at no home quarantine. So that's good.
You guys are meeting, the PAGS meeting, I think is it Thursday there in Guam? You guys meeting tonight?
Yeah, we meet tonight. Yeah, we have to discuss what is mean by 80%. What coming out and what's the difference. So that's the main things. And we really will meet on get some guidance and thought on what to do with the vaccine next year. We really have to worry seriously. Because this virus is not going to go away for a long, long time. But if our current defense is immunity from the vaccine, if the immunity is down and you don't have your vaccine on time, you're going to get sick. Your risk of getting sick is high.
Are you guys talking about not wearing masks or anything like that? Because I'm over here in Vegas, and I was on the strip yesterday, and I saw nobody. I felt so uncomfortable. I was probably one of the few people, aside from my brothers, that were wearing masks, and it was really awkward. Even when I stepped outside, there was no social distancing. People were just roaming the streets, having a good time. No masks at all.
No, I tell you, the mandatory mask use will be there quite a while, even we reach 80%. I think we're very firm with that. Mask use have been shown to cut down the risk of infection quite a bit. And around people that that they fully vaccinated. Okay, just around any gathering or at your household, masks you don't have to wear a mask. But in public, there's about at least 15-20% of us out there that will not be vaccinated, and those are the high risk patient now. Doesn't matter how old they are, and again, those people still can carry the virus, and so you still need to wear your mask in public, especially in a crowded place. I think that most of us are so used to it in the past year that habit will be not easy to give up at this point.
Right. Well, Sabrina's in Vegas.
What about
an article this morning? Even in the United States, we see the same thing, right? The majority of people in the hospital now, COVID-19, are unvaccinated. And, that's the message that we want to get across, is that vaccination cut your risk of hospitalization down significantly. That's the main reason, and if you have the virus and you're vaccinated, the chance you're not going to be that sick, the chances that the transmission rate is very low to people around you. So I'm not still quite sure why people are still waiting. I think that half and half still wait. The other half is really, they're not going to get vaccinated. Doesn't matter what. That's personnel.
Maybe we need to make it $20,000 a week.
Yeah, and the people that still hesitant because misinformation out there somewhere, they need to talk to the physician and get the true picture of the risk and benefit of the vaccine and get themselves vaccinated. That's the other half of the people that are still unvaccinated that have some hesitancy because of some misinformation. So get the right information, get yourself protected. Again, is for you, for people around you and your family you want to protect.
We had Chima on yesterday, and I asked about mandatory vaccination, for school children specifically, because TB, it's required that you have the TB shot before you go to school. Is that something also the PAG is talking about?
Yeah, mandatory vaccination is something we definitely talk about. I know GRMC is mandatory now, and AMC been mandatory now for the past 2 or 3 weeks, so we're 100%. There's no exception with if you're pregnant, if you worry about if you have some religious belief or you have some medical condition that really you cannot have. But mandatory vaccination is going to catch up with the private sector. There's a lawsuit recently, and I talked to my brother that he's work in Pensacola, Florida now, and his hospital is waiting for the decision of the I think one of the hospital in Texas, Methodist something, that put a mandatory for all the employees at the hospital to be vaccinated with the COVID-19. And 100 people will file a lawsuit for that in the federal court, and they lost. The federal judge say that you have a choice, go work somewhere else, but the hospital will have the right to mandate the COVID-19 to protect the patient and protect themselves. So I think that's going to be catching up here, and if it's challenged right now, but if the next level of court that will also endorse that that hospital, I tell you, there's a lot of hospitals follow, including the hospital he worked in Pensacola, because they really like to be mandated that. For the school, we really have to go back to some face-to-face. The kids are devastated for them to be homeschooled. I tell you, they miss a whole year of school. So, that's something that if we mandate people to have PPD skin tests to be safe, but that's infectious, right? And COVID-19, the same thing. There's possibility that you can mandate the student go back. That's why we try to push so hard during this summer for the kid to be vaccinated, because that 3 feet distance need to go away, by next year. There's no reason to have 3 feet. Now, you can wear masks in school, but the 3 feet distance for learning, they can go away next year. And that's something that I think the physician advisory group are trying to push for that direction. It's up to the DOE superintendent to make decision, but to us, we feel comfortable that social distance can go away if at least 80% of the kids are vaccinated.
All right. Well, thank you, Doc. Thanks for always being accessible.
Right on. Appreciate it.
All right.
Guys, be
Stay safe.
You too, Doc. Okay, there you go. Dr. Hoa Nguyen, Physicians Advisory Group Chair at 7:54. This is the link. Good morning. Coming up, we're getting Jerry Perez, the Deputy President of the Guam Visitors Bureau, and I think he's going to be joined by Uncle Carl, the President of GVB. Also coming up here, we have Gary Hiles, Chief Economist for the Department of Labor, Sergeant Paul Tapao, the Guam Police Department, and we're going to go live to FSM Consul Therese Philippine, who's going to be standing by at the airport as another repatriation flight is scheduled to depart this morning, Sabrina?
Right. That is going to be departing today. And a lot of the FSM citizens, as you know, have been stranded not just on Guam, but in other parts of the country. Yeah. And so prior to departure, they have to do a quarantine here.
Pre-quarantine.
And then they're able to leave. Then they have to have the COVID vaccination before they get on the